All right, let's rise for the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I want to welcome everyone to the February 5th Health and Human Services meeting, and you have an agenda in front of you. Any additions or changes?
No, sir.
I'll move it.
All in favor, please say aye. Aye. Any opposed? All right, your minutes from January 8th, what's your pleasure?
Support.
All in favor, please say aye.
Aye.
Any opposed? All right, brings us to our first limited public comment. If you're not here in an official capacity, anybody want to say anything? No? All right. Be another opportunity at the end of the meeting, which brings us to Emily. Barry Eaton District Health Semi-Annual Report. Take it away.
Hi, everyone. My name is Emily Smale. I am the Communication Specialist and PIO for the Barry Eaton District Health Department. I am here to give an update about our services over the last 6-ish months. If you could scroll to the next slide. Okay, so here's just a quick overview of our services. Our Environmental Health Division covers our restaurant and food programs, our on-site drinking water wells, our recreational water, campgrounds, body art facility licensing, and adult foster and childcare facilities. Our Planning and Promotion and Evaluation Division covers the community health assessment and needs assessment, our coalition and advisory group work groups, as well as our media campaigns, social media, press releases, grant writing, data collection, program management. And then our Personal and Community Health Division covers adult and child immunizations, women, infant, and children, our WIC program, hearing and vision screenings, lead level tests, our children's special health care services, and communicable disease investigations, as well as STI, HIV testing, counseling, and treatment. We'll go to the next one. A few updates from our Environmental Health Division. The first is a food inspection grant that they were awarded. This is a $19,000 grant to bring our food inspection program up to the national FDA standard. They currently follow the Michigan Food Code. And this grant will be awarded to help us, sorry about that. The program is meant to follow the FDA standard, which is a national standard developed by FDA and NEHA, which is the National Environmental Health Association, and will make our department one of the only few ones in Michigan that has that credential. So we'll be working on that in 2024, as well as Hedgerow, which is a software that we're implementing. We've been working on this for the past 6 months, and it will update our capabilities more than what we're able to do right now as far as data management goes. And we are hoping to launch this in early March of 2024. Planning, promotion, and evaluation. One of our programs that we have is Baby Cafe. This is an informal group for moms to meet and get advice from peer counselors and other moms about breastfeeding. They meet on Tuesdays in Barry County, and then we've changed the date in Eaton County to Wednesdays from 10 to 12 at Alive in Charlotte. And we have Valentine's parties planned for the moms around Valentine's Day. And our community health and needs assessment, as well as our community health improvement plan, called CHA-CHIP informally. In Eaton County, we are part of a group called Healthy Capital Counties. This is a partnership with Ingham County Health Department and Mid-Michigan Health Department, covering Clinton County and then Eaton County from Barry Eaton. This, most recently, our community health needs assessment was published in 2021, and the most recent community health improvement plan was published in 2022. By the end of 2024, we'll be publishing the next cycle of the community health needs assessment, and then a 2025 CHIP next year. And those documents can be found at the healthycapitalcounties.org website, as well as the barryeatonhealth.org, which is our health department website. So another part of our planning, promotion, evaluation unit is the substance use and misuse strategic planning process, which I know some of you may have been involved in. This strategic planning process is intended to increase coordination and collaboration in response to the drug overdose crisis. And we're hoping that through this process, we'll have a better understanding of the current substance use landscape, as well as the current needs, what our capacity currently is, and where the gaps lie. The strategic planning process started this past December and will continue through June of this year. And we will present the full strategic plan to the Eaton County Board of Commissioners in July of 2024. Our next steps are the Community Needs Assessment Survey, which we'll begin disseminating in February. We have subcommittee groups that will start meeting in March, and then focus groups will begin in March as well. All right, at the end of last summer, we installed a health resource vending machine in our lobby. This machine is full of items that are free to anyone, no questions asked. In the machine, there are Narcan kits, fentanyl test strips, Wear One supplies, which includes condoms and information about STI testing, mini sharps containers, drug disposal bags, menstrual products, and CPR face shields. And to update about one of our larger grants, our Overdose Data to Action, also called OD2A, is a grant that we were awarded by the CDC. Looking forward to this year of the grant, we'll be adding additional vending machines throughout the county, working with our partners to get those implemented and start talking about it now and through March. We are contracting with Community Mental Health to provide funding to employ a peer recovery coach to serve Eaton County, as well as expanding our own Connections program to assist with connecting clients to substance use treatment, harm reduction resources, and other social determinants of health. So those are housing, income, things like that. We are out through that program. We're doing more outreach to the jails, hospital systems, and community organizations, which has begun this month. And then we are implementing a overdose fatality review team, as well as improving our data collection and sharing. So our personal community health division, recently on January 1st, 2024, new legislation required that children 12 months or at 12 months and 24 months, children should be tested for lead, as no amount of lead found in the blood is safe for children. This is an effort to try to catch those things early and start some of that mitigation process. And although lead poisoning rates have fallen, there's still 4,000 children in Michigan that are diagnosed with lead poisoning every year. And as I mentioned, finding lead early is one of the best ways to keep kids healthy, active, and safe. One of our other programs that we want to update about is Connections, which I mentioned a little bit with the OD2A grant. This is a community health worker program. They provide health educations, referral to resources in the community, making sure people get the help that they need. This program we've been expanding, and we are starting to connect folks with substance use disorder resources. We had a new CHW start today, so we now have 3 community health workers that work for Barry Eaton District Health Department. And we're working towards getting our community health workers out in the community more to meet the clients where they're at. And we are always open to ideas or considerations for the community health workers if you have a specific idea or area that we could explore in Eaton County. To update about childhood immunizations in Eaton County, we're focused on increasing these rates due to the drop during the COVID pandemic. There's an effort to keep these kids up to date. This graph here shows the percentage of Eaton County children vaccinated at these different milestones versus the state. So the gray bar is Michigan and the orange bar is Eaton County. In the age groups 1 month, 3 month, and 5 months, we are ahead of Michigan, the average in Michigan, but for 7 months, 16 months, 19 months, 24 months, we are below the Michigan average. And I also do have an MCDC update. Our Michigan Community Dental Clinic here in Charlotte, they are currently fully staffed with 1 full-time dentist and 2 full-time registered dental hygienists, plus their support staff. They're open Monday through Thursday, 8 to 4:30. They're currently booking out into mid-May for new patient appointments, which is better than most MCDC centers in Michigan. They do also offer same-day emergencies and can often work patients in sooner if there's cancellations. In 2023, they had 2,956 unique patients and a total of 6,333 office visits in 2023. They are slated to receive 8 new dental chairs and a new panoramic x-ray, which is funded with state special project funding, and hopefully to be installed in June or July.
Very good. Questions? Jeannie?
When they add the new dental chairs and things, are they going to increase it to dentists?
You know,
We aren't sure on that. We just received this information on Friday, so this is new to us, so we can absolutely ask.
I hope it's something that would say that we would have two dentists.
Yeah, I know that they've struggled, I think, around the state even to employ or to recruit dentists. So it's been hard to retain them in centers all over the state. I know that that was something that they were facing here at our center as well. So that could be part of it currently, but yes, we absolutely can.
Do you know if they ever did have two dentists over there?
They did at one time.
That's what I thought,
Yeah,
okay.
They did at one time.
Thank you.
Go ahead, Mark.
Good morning, Emily. Thank you for your report. My question is in regards to restaurant inspections. Does your department handle those?
our environmental health division does hire restaurant inspectors.
And how is that going? I'm seeing more reports in print now.
It's going well. All of our reports are available online through our website, so if someone has a question about a restaurant, they can look and find all of the reports that way. But I don't know if you have more to add to that.
Yeah, I'm not sure whether that's our communication department doing that or your
You're
department.
seeing it in the news, is that?
Yeah, I'm reading it somewhere. I can't remember exactly whether it was Lansing State Journal or some other.
Yeah, I think because that's available on the public, they pick that up. That's not something that we send out actively to them, so
Oh, okay. Interesting.
they're doing their investigative journalism there.
Thank you.
Blake, did you have something? Blake and then back to
I'll take
Jeannie.
First of all, the dental clinic, just for the members, you know, that's a third party that runs that, but it's jointly coordinated with the health department and with the county. And it isn't just for Medicaid patients. It's a sliding scale, and I've known people and have, generally younger people don't have a good connect, or people that move into the area don't have a good connection with a dentist. And it's a full-service dental clinic that takes appointments, and, you know, the sliding scale is helpful, because a lot of people, as you know, dental insurance is always sort of sketchy to start with and doesn't cover a lot of things. And the quality of the dentistry there is as good as anywhere you're gonna get, you know, right from children to aged people. So it's, let your constituents know about it. It's kind of underappreciated around the county. I mean, I keep bumping into the people that never heard about it, and they have issues with dentistry and paying for it, and it's a quick phone call. So I think it's important that we're aware of it. You know, it's been going on for 15 years or thereabouts, and sometimes we forget about it. But it's one of the benefits that we have here at the county to help not just our residents, it's available to anyone. But obviously, being in Charlotte, our residents are the ones that are going to take advantage of it, so.
I know they do see a lot of clients from around the state too, because I'm assuming they're quality and.
Jeannie, then back to Mark. Go ahead.
I was going to say, I think, Mark, that he was seeing it in the Lansing State Journal because there was some restaurants in Delta. But that might be something too that we can better promote, like in your newsletters or something else like that. Because I also send people over there that don't have an affiliation with a dentist office or something. And it's always been, that was the reason we brought it here, was because we were short on dentists that would see Medicaid patients, but also for other people who didn't have dental insurance. So it really was designed to help so many in our county.
Yeah, absolutely. And we do have an Eden Oral Health Coalition that does some of that work to promote it.
Okay.
Go ahead, Mark.
I just want to piggyback on what's previously said. People don't understand how important dental health is for your overall health. Okay, there are some infections that could be brought on by dental problems that could actually lead to detrimental health concerns. So I'm really encouraged with the dental clinic and all the work that was done to bring that on board. Thank you.
Very good. Barbara?
Is there any printed literature that we could get to share with our constituents on that? Of the availabilities?
Yep, we have some literature about it. We can
Okay, so I could stop over there and pick up some? I would really like that.
Yeah, absolutely.
Thank you.
Blake?
I think another, Miley, if you want to address it, but one of our new programs, and it's really new, has hardly even started, is the overdose fatality review team. It's a new program that's been done around the state and more around the country. And frankly, historically, when somebody overdoses, they chalk it up as an overdose and they put it in the statistics and that's it. Miley can give you more of an update. I'm putting you on the spot.
That's okay.
You better be able to handle it.
Yep, no, fine. So it actually, I think probably last month or maybe the month before that, some legislation passed that allows to de-identify overdose cases for the purpose of this overdose fatality review team. And so what we were doing in Michigan before was our medical examiners' offices were sending us or able to kind of abstract all the information from a case. And so they're able to call the sheriff's department if that person was involved in law enforcement or criminal justice initiatives. Maybe they were at the jail at one point in their life, and they're able to call doctors' offices and kind of get some information about maybe what treatment they've had in the past, kind of looking at those things that might contribute to some of the factors that maybe led to this overdose. And of course, you can imagine that they ran into issues because at the time, we didn't have to have this shared. It wasn't required that the doctor's office or the jail share that with the medical examiner's office. And so with the legislation, this is really going to open up the door so that this information can be shared, and then we can have these really extensive overdose fatality reviews. What an overdose fatality review team kind of does or looks like is for us in Eaton County, it depends on the number of decedents you have in your county. So of course, larger counties who have more overdoses are gonna be able to meet more. But in Eaton County currently, we're doing quarterly. We may do every other month, but at the moment it's quarterly. We take one case, someone who had overdosed and passed, and we review all the factors. And as a group, we discuss, what did they have access to? What didn't they have access to? What could the social services done? What could they have been engaged with that maybe they weren't? Who do we need to get to the table to address this crisis? And then after usually 3 of these review teams, we have a larger group. It's a community action team group. And this is where we really talk about the recommendations for the community of what we found from the cases we reviewed and what we would recommend based on what we found. So here in February, we'll have our next one for Eaton County, and it'll be a lot more robust because of the legislation that passed, and now doctors' offices have to share this information, law enforcement has to share their information. That legislation really helped to open the door to get some good information.
Thank you.
Any other questions? Thank you very much for your time, ladies.
Here.
Strategic plan update.
Yes, so this is the substance abuse misuse plan update specifically for the update. We had a follow-up meeting to the December kickoff in January. Unfortunately, that had to be rescheduled due to weather. And we had it for January 29th. And then due to registrations and a low attendance, we actually switched that to be all online. So that was all virtual. It was a mapping exercise for where things are in the community and where people can go to get assistance. So that was done. We started meeting with MSU for the community surveys that we're going to be working on. We met with them as recently as Friday. So the surveys should be all complete now, and those should be going out shortly. And that is where we are.
Very good.
Let me
Yeah, go ahead.
back a little bit, because that's, in the end, going to help this board determine what we want to do with our funding and where we want to send the monies and what is important to us. And I want to thank MSU because they've kind of been into this program. They've created a program that's being used statewide, and it's, they've created the wheel and we can turn it. So that's going to be a nice help for us in our plan. In the end, of course, it's not a lot of money, but you're going to be the ones determining where it's going to be spent and how it will be spent. And this is just laying the groundwork to give you the facts to know where the need is. Obviously, there's need everywhere, but it's a small amount of money, and so we're going to have to be more focused, and without some sort of input from the community and from the some sort of a survey that we're taking now of what we've got going on with drug misuse and abuse, we don't know what to do. So I think these are important steps, and I want to thank Kaylin at the Health Department and for the work that they're doing, and hopefully we'll have some results and we'll be able to create some direction in the near future.
Joe?
Yeah, Blake is right. It's not a lot of money. It's approximately about $350,000 a year from what we have today to the 18 years this is supposed to cover. I would just like, what I would like to do is see this ultimately be an overall plan to attack drug abuse in this county, and maybe take that money more or less as seed money at the end of the day. The other thing I'd like to make sure that it happens is that the other program that was spoken of this morning with the medical examiner, that's, I think, very important information that needs to be incorporated into the report that we ultimately get in regards to making recommendations. And so those two things, I think we should keep in mind that it should be the base amount that maybe we can utilize to attack this problem in a better way, and that we get all of the pertinent information available, because that will give us the best idea of what the problem is, the extent of it, and what could be done to address it.
Very good. Yes, Jeannie?
I would like to add that last night I seen a commercial, and I don't know where they're getting the funding from to do that, but it was on Channel 6, and it actually showed two different pills, but they looked just alike. They just had a little different print on it, like, a dose or something that you would see on a typical pill. But it was an actual commercial trying to draw the attention to the people that when they're buying these pills, aftermarket and things, that you can buy one that does have fentanyl in it and create a critical situation. And it was the first time I seen that commercial. And I thought about, being able to do something like that with some of that money to get it out. And, like, draw the attention to the parents and things, because you can buy things online and parents don't even know about it. So if the kids start watching it, I'd like to see it about 7:30, 8 o'clock at night on TV.
They don't watch TV.
Oh,
So you're assuming they're watching Channel 6, that's not.
right.
That ain't gonna happen.
Put it on TikTok or.
They were watching maybe the
over
Grammys last
60.
night, but that'd be about it.
Something that Emily talked about here in this report were these drug disposal bags. And I don't think if you don't understand what they are, it's actually, historically, if you had extra pills in your cabinet, you're not supposed to flush them because it has ill effects on the treatment. You're not supposed to, just put them in the trash. What do you do with the darn things? It used to be you took them over here, or you still could, to some drugstores or here at the county where you threw them into a big bucket and somebody looked at it. Apparently, these bags, you put your medicines in there and it detoxifies them or does something to them, and you can put the disposal bag into the garbage. And, kind of it sounds so simple, but there was a problem that people really didn't understand. What people did, including me, I look in my medicine cabinet and I have prescription jars there, bottles from 15 years ago, because you don't do anything with them. They just sit there. And we all know that that's not a good thing. We all know we're going to do something about it. We all know that we have a plan to fix it, but none of us do diddle. And this is a way that we can take care of a problem that's very minor, unless you get children or someone getting into your medicine cabinet or curious teens. And this is a way that you can fix a problem. And I guess I bring it up because it's something that we have, it's something that the health department makes available. And again, something that our citizens probably know nothing about, and, they don't realize it, but they're adding to the problem. We deal here with this, with the drug review, with the death review team. Young kids start their habits occasionally by getting pills in bottles out of their parents' or their grandparents' medicine cabinets. And this is stuff that was legitimate, it was needed for pain, but it just sits there. And get rid of the darn stuff. And now we have a way to do it. So I bring that up as a point of information, and if anybody's watching on YouTube, and it's all available, and we have it, take advantage of it. So, thank you.
Just to add to Blake, I've gotten these packets from Tri-County Office on Aging, and the problem is that the drugstores would take it only if you bought the drugs from them, okay? And I know the Delta Patrol had a drop-off point, but these packets are extremely easy to use. There's a limit to how many pills you can put in them, but they made my life a lot easier. And I'm glad Blake brought this up. Thank you.
Very good. Anything else out of miscellaneous?
The only thing that I would mention is that we are still dealing with bankruptcies through the opioid settlements. There are 4 right now that we're looking at. It's Endo, Mallinckrodt, Purdue, and Rite Aid. No movement on them yet, but I'll keep you posted.
Okay. Very good. Any second chance for limited public comment? Go right ahead.
I just want to let you know that a lot of Myers they have a drop box for drugs in their pharmacy areas. So you don't have to buy them there. You don't even have to talk to the pharmacist. So a lot of Myers in the area, you can drop your prescriptions there as well.
Very good. So Myers stores and pharmacies are a partner in this. Great. Thank you so much. All right. That brings us to adjournment. We'll see you all next month.